Hi, I'm Dr. Traci Sweet, co-founder and COO of Whole on Health. Today we're going to talk a little bit about traditional approaches to treating substance use disorder. Many of you may be familiar with cognitive behavioral therapy. It's been sort of the gold standard in care for decades and decades. It takes a look at your past behaviors and how you have insight for them going forward so that you will not repeat those behaviors as a pattern in the future of your life. So it takes a long look back, makes sure that you're ready for change using motivational enhancement, which is another type of therapy, and then brings you forward into your future. Cognitive behavioral therapy is most often paired with motivational interviewing or motivational enhancement therapy, which I'm sure is probably also familiar. Motivational enhancement therapy really focuses on the stages of change, and it's thought of as a wheel, and where you come into treatment, really how that affects your motivation to change. Motivation is required for those that engage in cognitive behavior therapy. You have to be motivated to do the work, to go back, to look at your history, to look at your family, to be open to discussing this. And you also have to have the ability to share your insight and share your mindset and where it stands now. So it's been used traditionally for many, many years. There are other forms of cognitive behavioral therapy. One that I'm sure you're familiar with is moral reconation therapy. And moral reconation therapy is a form of cognitive behavior therapy specifically for the justice population. It's been around, I think, since the early 80s, don't quote me, but it's workbook based, and I'm sure many of you have bought many workbooks for your clients. It's also group based. It again looks at stages of change, a person's ability to change, their insight into their issues and their change. But it's sort of, it's not for everyone, and we know that. And if cognitive behavioral therapy itself was for everyone, we'd be in a different place than we are now, fighting this crisis of substance use disorder. So I think there are room for alternative therapies. One of the things that Whole on Health looked at, and I looked at when we started Whole On, was more positive psychology, particularly for the justice-involved individuals who are commonly coming to us having been through MRT, having done cognitive behavioral therapy, using the workbook. Sometimes we refer to them as adult coloring books because they can open it, they get into group, and they turn to the page on urge surfing, and they say, I did a lesson on urge surfing today. We took a different approach, and we decided that we wanted to be more positive-based, less stigma, less punishment, less judgment, moving forward in a person's lives without affecting or considering those past behaviors. Our clients find it refreshing that we don't want them to talk about where they've been, what their crime was, how they grew up, what their siblings did, what experiences, what traumas they've had. We really come in, we bring clients in to today is the first day of the rest of your life, and where do you want to go in your future? I do it in job interviews. I ask people what they want to be when they grow up, specifically because we all have future goals and aspirations. Even people that have climbed the ladder of corporate success have goals and aspirations still. Where do you want to go? What do you want to do next in your life? So when our clients come into treatment and we say, we are not traditional therapy, we're more positive psychology, and they ask what it's about, and we say, if you had a magic wand and your life was to be completely different tomorrow, what would it look like? They think, well, you don't want me to tell you where I've been, you don't want to talk about my relapses, you don't want to talk about the therapies that I've done or the doctors that I've seen or the time that I spent in prison or what my mother did to me when I was a child? No, I'm not going to judge you based on that, but I am going to help you move forward to your goals. So there are many additional kinds of treatments that are used for substance use disorder, and this is a big problem. There is not a one-size-fits-all, and I'm not suggesting that solution-focused therapy or cognitive behavioral therapy or even moral reconation therapy as part of CBD is the be-all, end-all for everyone. There are a number of other therapies out there that work just as well. We just decided to take something that was more positive and less punitive. And our clients truly appreciate the benefit of not having to repeat things that they've said over the past years of their life.